You can see that. Okay. So yogasana and pranayam, that's what we were talking about. So whatever that we do in yoga is basically somehow to get to the alignment, us to alignment, right? Whatever we do, if it is not getting alignment happen. So alignment of what? Body, mind, and intellect. Now, if somebody has a pain in the body, let's say knee pain, and he cannot sit properly, or a hip pain, he cannot sit properly. So what happens is you are disaligned, right? You cannot. Can you sit down for in quietness? No. It is very important. This very essential that our body is aligned properly. Which aligned properly means if we are completely oblivious of our body, not by drinking and getting drugged, no, 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 by being, when you sit down quietly, you are completely oblivious of your body, and absolutely no pain and no high blood pressure, no tension, and no this cancer and no nonsense, right? If that is happening, then our body is really aligned. Now, it is also possible that the mind is monkey mind. It keeps running around left and right. So how do you still that? Intellect, of all the thing, intellect controls the mind and the body. So if the intellect is not properly aligned, so as Smriti ji said that it is um, the prefrontal cortex. Sujna ji also said that prefrontal cortex and all that. The prefrontal cortex is this part of the brain. This is the part of the brain which controls everything essentially, all of the stuff. But this part itself gets controlled by other parts. So there is a loop, right? So this is what it is. Now, this is how I started my life. So if there are youngsters in the group, they would. I hope I have not scared them away by giving high level of these word jargons. I am sorry if I have lost them. Please invite them again. So, so what happens whenever we doing any yogasan, any yogasan for that matter? Always, it's a great idea to do three things necessarily while doing yoga. Any yogasan, any yoga, whether it is Surya Namaskar or anything. Now, I'll give you a story about Surya Namaskar. What happened in my life? I have repeated that several times wherever, and I keep repeating that because it makes sense to a lot of youngsters, especially. Say I was 15 years old, and there would always be a person in my class who would harass me and make me uh, give my lunch to him all the time. So I had to give him the lunch, and after the lunch break, I had miserable life. Could not focus because acid was getting released in my stomach all day. So it was a horrible situation. A few months went by and I was having the same problems. My grades were dropping off and things like that. So my father asked me, what is going on? So I told him this is what is happening. And I was dreading the very fact of getting early in the morning. Very, very difficult to get up early in the morning. So I was fearful all the time to go because I would be beat up. If I am walking in the corridor, they will put a leg behind just in front of me so that I trip or do something or the other. And I'm standing, somebody sits behind me and somebody gives a push, so I fall down. So these are the kind of thing used to go on in my life. And when my father said, "Okay, do one thing," he pulled out a BKS Iyengar. He was a acharya of BKS Iyengar yoga school. Okay, so he pulled out a three page pamphlet, and he said, "Why don't you do this Surya Namaskar every day?" So I was trying to do, but it was not happening. So he helped me. He got me trained it to do Surya Namaskar. So after having done, he says, "Do one new Surya Namaskar today, do two tomorrow, three day after tomorrow, and that way go and increase it to the point of 100 in 1 month, or in not in 3 months time or whatever that 100 days. After that, you tell me what is happening." You know what will happen? What happened after 100 days of doing Surya Namaskar to the point of doing 100? on the 100th day, I went up to that fellow. I said, "You can take my food, but not my appetite." He did not snatch this time. I gave it to him. I said, "You can take away my food, but not my appetite. Remember that." And he felt something different about him, the very demeanor that I had. The way I was standing, the way I was confident about myself, that gave me the first feeling and first experience of what it is to be fearless. He knew that guy knew that day that he cannot be tackled anymore. So that is the first benefit of Suryanamaskar, fearlessness. So how does that happen actually? So when you're doing the any body posture or whatever, the breathing, the posture, and the bandhas, these are the most important things. So I hope I have not scared youngsters and not going to scare the whosoever are right now here. So in pranic breathing, that which is called Ujjayi pranayam. So what you do is you have to constrict the throat little bit, just like that, like that. It should be just small constriction, and you can. It's almost like fogging the mirror with your breath, and not by blowing it, but by that type of a sound should come out. This kind. So you use this sound, but with the mouth closed. So this is how you breathe, Ujjayi. So this is how you inhale, exhale. But also one more thing that one has to do is hold. After inhalation, deep inhalation, Ujjayi breathing, basically inhale and hold. That is inner kumbhak, which means holding your breath. Why holding the breath? Because it allows for oxygen, carbon dioxide exchange to take place. That's why it is important, right? So then you exhale completely, get all the carbon dioxide out of your system, and hold again. That holding again after the exhalation is very, very, very important for developing the immune system. I'll talk about this later on in a couple of my other uh, few few presentation afterwards. I'll tell you how to do that. Why this would hold and exhale and hold is so important, because it protects our body from inside. So bone marrow gets this signal that body is some kind of a it requires more oxygen, so it produces more blood. And when the blood is produced, it produces all the T cells and all the immune cells and the fighter cells, the soldier cells, those cells who are protecting our body from outside influence, outside enemies, shatru, right? So that is very important. And then what you have to do is you have to do the bandhas. Say for instance, if you are doing the Surya Namaskar like that, I'll show you this. So this particular one is your first position in the Surya Namaskar. Let's say, I'll give you example. So when you're doing it like this, you are going to take some deep breaths, inhale, hold, exhale, hold, again inhale. So these are the things. So when you're doing the inhalation, this is the inhalation position. What is that? I'll show you. When you're doing this kind of a posture, you inhale. At the same time, what you do is you do the bandhas. Bandhas mean you constrict your floor plate, which is basically between your. I mean, it's your anus, right? Actually, that is the thing that you constrict it. And Udyan Bandh is when you constrict your abdomen, like pull it little bit, not like the heavy duty ones, but simple ones. just constrict, becoming aware of it. And then the Jalandhar Bandh means you do the bandha in such a manner that when you do, let's say, I'll tell you, when you do this position, you constrict your buttocks, you constrict your little bit, just a little bit of your abdomen, and you constrict your throat. How do you constrict your throat? Right here, it's very difficult, right? So when you're doing this, just swallow your saliva. That itself will trigger the process of this area, the Vishuddhi chakra actually, right? This area gets activated. So those are the areas which are, that area is considered to be important for thyroid function, right? So basal metabolic rate will be very much balanced if you do this kind of yogasan. Plus your abdominal area, which is basically Manipura chakra or your solar plexus, uh, will be very activated. So these are the things that we do. So this is number one, this is number two, and this is number three. So do this very exhale completely. Again, do the bandhas, three bandhas, exhale, hold. This is what it is. You do exhalation, hold. You inhalation and hold in number two, exhalation and hold in number three, and then four, inhalation and again hold, exhale, hold. So alternatively you have to do that. So this is what I was telling you. Now when you do a few deep inhalation and exhalation in this first one, this increases the thoracic size. You are not just doing this thing, you are just pushing your basically your palms against each other very strongly, very tightly, so that your chest cavity increases, thoracic cavity increases. Now when you do this, you are very focused. This increases focus, this particular thing is increased. Second thing is, when you deep inhalation, you do deep inhalation, what happens is it activates your agnya chakra, because you're bending like that, right? Pineal gland gets activated, midbrain gets activated. Anahata chakra, which means your heart chakra, because the heart muscles and all those things are, I mean, that sternum area, that area, this particular area between your chest, right? That gets stretched. So those are the areas which gets activated. Manipura chakra is basically your abdominal chakra. Swadhisthana chakra is at the low, even lower, and Muladhara is even lower. So this particular, even if you do this 10 times, just sit, come back in one position, do two position, come back in one position, do two. If you just do this 10 times, you will automatically have almost no fear or anxiety. Just doing this itself is so important. Same is another one. When you do exhalation and hold, this particular thing activates the Agnya chakra. What happens when you're bending like this? Whenever you're bending back or front, especially with the neck, this activates the Agnya chakra all the time. And what happens is, when you're doing this position, you're changing you're touching your chin into your into your chest. So that also. And when you're doing this, the bandhas, how do you do bandhas here? You constrict your base muscles, constrict your abdominal muscles, and constrict your throat. So that causes hormonal balance from all sides. This is so beautiful. So this is this anybody who has had abnormal hormonal challenges, if they do this position, it will be gone. Same is here, with deep inhalation and hold, and do the three bandhas. It activates the Mooladhara chakra, which means your so whenever you do this particular thing, you feel so secure. Mooladhara chakra is for absolute security, internal security, your psychological security. It does that. It is so powerful. It activates Mooladhara chakra, Manipura chakra, and Vishuddha. Now you will be considering. Somebody might ask, what is this Mooladhara chakra and all that? So I think I might have to uh, come back sometime to tell you the lowest of, let's say our body is from head to the buttocks, right? So at the base of our spine, we have a cluster of neurons which we call Muladhara chakra. Okay, we little bit, uh, just four fingers above that Muladhara, you will see Swadhisthana chakra. Four fingers more above will be Manipura chakra. Four fingers above will be having Anahat chakra, heart chakra, and about 10 fingers above will be a Vishuddhi chakra, and four fingers above will be a Agya chakra. So these are the kind of different plexus, or the neuronal plexus, nerve cluster is basically constitute a chakra. Okay, so when you do these kind of things, what it does is when you do this, you will find that you are doing such a strong uh, pull of your abdomen here, nice pull of the abdomen. This will massage your kidney so well that you will never have any blood pressure problem. If you do this yogasan just like this, you will never have blood pressure problem. This particular Ashtang Namaskar makes the spine supple. Plus, it activates all the chakras. So powerful. So this particular thing is best for the brain. This Bhujangasana. Why it is good for the brain? Because it activates your Manipura chakra and Swadhisthana chakra, which actually regulates your colon, kidney, intestine, pancreas. These things get regulated nicely, and this particular one has the biggest vagus nerve cluster getting activated. There is a big vagus nerve network in our abdomen, and when that get activated, you will find that your brain health will be always better all the time. There will be no depression, there will be no anxiety, there will be no dementia, there will be no Alzheimer, nothing. This is powerful. Bhujangasana. So this again same thing here also. So I mean I'm just giving you all this because everything is in repetition and reverse repetition. So this is how it is. Now when we talk about yogasana, right? We always want to know how do you know that such and such thing happens. So if somebody is doing already yogasana, then they want to know what it is. So this particular thing was done in Harvard Medical School. So they had done what they done. Yogasana session increases brain GABA level. Brain GABA level. Now, don't worry about this technological term. They just assume that there is some kind of a chemical, which if it is low can cause depression, anxiety, and all that stuff. So if you do yoga, then what happens is that particular chemical in the brain increases, which allows you not to get depressed, right? No dependence. So they say that this suggests that the practice of yoga should be explored as a treatment for disorders with low GABA level. GABA means gamma aminobutyric acid level, such as depression and anxiety order disorder. So this particular thing, depression and anxiety orders, is almost like pandemic these days in United States. Almost alternate every alternate three out of three people, one person is getting uh, depression or anxiety. So this is a kind of a 30% uh, increase in anxiety and depression post COVID right now. So this is very in my class where I teach, there are about 8 students out of 24 students. 8 students are having challenges like this. So I tell them how to do this yogasan so that they can get out of this medication. Anyway, so this is what they have study has shown that it happens. Now there is a movie here, but I cannot show that because uh, it's embedded somewhere else, and it is impossible to get it out until unless I click the paper itself. So I don't know. That's why I just took the thing out from there. So the neurogenesis is now GABA level. What does it do? It increases neurogenesis. Neurogenesis means making of new brain cells, right? Making of new brain cells is triggered by gamma aminobutyric acid, GABAergic neurons. So this is so important for neurogenesis. And obviously, when the neurogenesis is not going, the nerves are going down and dying, probably. That's why the depression. That's why the Alzheimer. That's why Alzheimer is nothing but progressive degeneration of neuron. Okay. Similarly, here also now progressive degeneration. Alzheimer disease always initially starts with depression only. It starts there. The depressed. Some people are depressed, and I said, "Oh yeah, oh it is a weather blues and this." No, 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 no. It is real thing. The depression is starting. It is a signal for neurodegenerative disorders to happen because the GABA levels are lower here, and the GABA levels are lower. No neurons are formed. No connections are formed, and eventually what happens is the brain will start to shrivel, and that's it, end of it. So that's what it is. There is another paper which talks about Iyengar yoga. Iyengar yoga, this is the one which I was taught by my father. Of course, Suryanamaskar was the first one in my life, 100 days of Suryanamaskar. But eventually he taught me almost all the yogasans of Iyengar tradition, and I'm so happy about that. So what they have done is they have done a study where they have measured the brain cerebral right uh, the signal. Just don't worry about that. The signal, which here whenever you see red, which means more blood in that area. That's all, right? This is fMRI study, functional magnetic resonance imaging studies. Okay. So what they do is wherever there is you ask the person to do a particular task, right? And during the task or after the task, you assess the blood oxygenation level. So bold they call it, blood, BOLD, blood oxygen level dependent signal, bold signal, right? This is bold signal. Bold signal means blood oxygen dependent signals, right? BOLD. So so if there is higher blood, what does it mean? Higher blood oxygen, which means that oxygen requires that particular area is getting active. The cells are getting active there. That's why it is called more oxygen is required for by the cells. That's why it has received more oxygen here, right? So whenever you see more oxygenation, now this particular thing has to be subtracted from this to get just the right oxygenation level here. So before the program, this was the oxygen level low, whereas after the yoga program, you saw it so high. So this shows that there is a greater cerebral blood flow in the right prefrontal cortex, shown by the arrow here. So, so that's why they say that yoga program activates the prefrontal cortex so nicely. And that is the reason why those people of the yoga tradition could think out of the box. Most people would consider those people are they must be crazy or what? What are they thinking? No, they are thinking beyond you. They are not even thinking at that level you are at because their brain is wired up definitely differently. That's the reason, and that is the place where people have started to appreciate yoga practice big time, right? Now, what does it do? What does it do by when this blood is increased in the prefrontal cortex? What happens? obviously people will have higher empathy. This is a this is coming from Lancet. Lancet is one of the, like, the number one journal in the world. There is nothing to beat that. And they say that this part of this kind of a yoga program allows people to empathize, not to kill others or not to hate others. Empathy, which means if there is somebody suffering, I'll go out, reach out myself to help him. At that time, when you are empathizing with somebody, automatically this particular thing is increased. Or if you do yoga, you will get empathy. Or if you are already empathetic, you will have this blood flow here, and limits the impact of selfish motive, right? So me and mine, give it to me. This is my thing. I want to hold. I. That is selfish behavior. Whenever you see in Bharat, they allowed whosoever wanted to come very nicely. You can come on over. We'll live together happily. So this was the selfless behavior, complete selfless behavior. And if they were hungry, they will feed them nicely and empathize with their life and things like that. Let's have live together. This was the 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 culture, right? This was the Sanskriti that we had in Bharat, which allowed this kind of a behavior, right? Empathetic behavior, gratitude behavior, and selfless behavior is coming from these kind of a yoga traditions. Same thing is Kundalini yoga, right? They say that these technique, Kundalini yoga meditation, these techniques are specific for phobias. If there is a phobia or addiction or substance abuse, major depressive disorder, dyslexia, grief, insomnia, and sleep disorders, these kind of thing get uh, solved. Same thing is Sudarshan Kriya and the treatment of stress and anxiety. They said stress, Sudarshan Kriya, Bhrastika, these are different process in Sudarshan Kriya. Of course, almost all the Kriyas have similar situation. The only thing is few um, nuances, differences, some, that's all. Otherwise, everything is the same. Ujjayi, Bhastika, Sudarshan Kriya can elevate anxiety, depression, everyday stress, everyday work related stress, driving stress, employer employee stress, all this post traumatic stress, stress related medical illnesses, all these things are taken care of by Sudarshan Kriya. Now there is another one which is Brahmari. This is, I think, uh, Shruti has asked me this, right? Shruti you asked me about the gamma waves. So yeah,
Yeah.
Brahmari, yeah, the Brahmari pranayam. When you say that type of thing, you close your ears and do that vibration is what causes gamma wave to come out of the basolateral amygdala. There is a region in the amygdala. There is a region in the brain which is called amygdala, which is basically it's a it's it's a fight and it allows for you to uh, react instantaneously, that portion instantaneously. So when you are once that is extremely highly activated, it hijacks the entire nerve signaling going and blood supply going in other parts of the brain. This is where it subsides. So this gamma wave from basolateral, the same amygdala which can cause amygdala hijack, can also cool it down if you do the right Brahmari pranayam, a yogic breathing technique. This is so powerful. The stuff that is causing extreme fear, that you do illogical things actually at the, like, the spur of the moment, spontaneous, and this is called actually amygdala hijack. Amygdala hijack means it is taking complete blood supply and nerve signaling towards your fear and fight and flight area of the brain. It takes it, gets there. On the other hand, if the gamma waves are created in the amygdala, then it is relaxed. This is the beauty of it. So how do you cut down your amygdala hijack? By doing Brahmari. So it causes extension of fear. So this is
So
exactly
just
where